Hello, greetings. Welcome, everybody. Hello. Welcome to the Center for Brooklyn History. My name is Marcia Eli. It is my pleasure, on behalf of my colleagues at the Center and my colleagues at the Brooklyn Public Library, which we are part of, and the team that does the arts and culture programming for the library, BPL Presents, to greet you. So welcome. It's truly a joy to join hands tonight in celebrating the New York City Department of Health and Mental Hygiene's 220th anniversary. Yes. I want to thank Dr. Morse and everyone at the DOH planning team for this partnership. It's really been a joy, a total joy. And thank you, all of our extraordinary panel. You will hear more about them shortly. Tonight's focus, what historic records and primary documents tell us about the history of race and racism, aligns perfectly with our work here at the Center for Brooklyn History. The heart of this institution is the collections we steward. Day in and day out, scholars, historians, researchers, students, curious people from all walks of life spend countless hours here digging into the documents that make up our special collection. So many of those documents, from slave bills of sale to our core collection, Congress of Racial Equality, reflect on the history of racism in this country and all of our weekly public programs, our education programs, our exhibitions, everything we do, we aim to use the collections and this stage to shine a spotlight on that history. History that is sprung from what the great historian Eric Foner, who will be here next week, called the original wound of slavery. That history is often, way too often, erased and denied, and especially now. Mostly, I want to thank all of you for joining us tonight. I hope to welcome you back for future programs here at CBH. And a quick note, following the presentation and moderated conversation, we'll take questions from you. Our ushers will bring the mics to your seats. Please help us by standing when you ask your questions. Now it's my great pleasure to introduce Dr. Michelle Morse, the Acting Health Commissioner and Chief Medical Officer of the New York City Department of Health and Mental Hygiene. An internal medicine physician, Dr. Morse is co-founder of Equal Health, assistant professor at Harvard Medical School, and served previously as Deputy Commissioner for the Center of Health Equity and Community Wellness. Her commitment to advancing health equity and justice is reflected in her role as Deputy Chief Medical Officer of Partners in Health, as a Soros Equality Fellow launching a global campaign against racism, and as a Robert Wood Johnson Health Policy Fellow with the Ways and Means Committee in the U.S. House of Representatives. Last year, Dr. Morse was named a Time 100 Next honoree. Please help me welcome Dr. Michelle Morse.
Good evening, everyone.
Good evening.
What a sophisticated room. This is such a beautiful space. And I'm so thankful that we actually get to have this conversation come to life this evening. It's wonderful to see so many public health friends and colleagues in the room. And if you're not in public health, I'm glad you're here too, and hope that you'll ask some really powerful questions. I think the questions that we're going to raise in the conversation this evening are in many ways timeless, but they are particularly timely with what we're witnessing in our country right now, and certainly what we're witnessing in terms of attacks on public health as well. So with that said, I just want to reflect for a minute on kind of how this idea came to be. As Marcia was describing, this is our 220-year birthday for the New York City Health Department. We're the oldest and largest health department in the country. And yes, and that is very important for a city of the complexity that we have here in New York City. And this 220 birthday has been an opportunity for us in the health department. And there are 7,000 of us in the New York City Health Department, and it's not enough. Raise your hand if you're from the New York City Health Department. Yeah. Amazing. So, so you're sitting next to public health heroes, the real life, everyday public health heroes. And it's been a challenging birthday year, but a really important one. And we've used the opportunity of our 220th birthday to really take a step back. And as we've been saying, look back to look forward, particularly again in a time when the support and partnership that we would expect at the federal level has been truly the opposite of what would be ideal for protecting and promoting the health of New Yorkers. And I think the conversation tonight is just one piece of that conversation about what's happening federally and how it impacts us. But as a way for our leadership team at the health department to kind of model this idea of looking back to look forward, we went to the Department of Records in February or March of this year. And our tour of the Department of Records with Commissioner Toole, was really breathtaking. And we got the chance to, thumb through records from hundreds of years ago, including the minutes of meetings from hundreds of years ago. We got to see Abraham Lincoln's name written in the documentation of, at the time they recorded every dead body that traveled through New York City because of issues of contagion and spread of diseases. And we saw Abraham Lincoln's name in that ledger, like the actual original book. And we also saw something that you will see here that really provoked me to propose this discussion tonight, which was that in the late 1700s in New York City, there was a law passed that essentially said that all people who are born enslaved in New York City have to be emancipated by their 18th or 21st birthday. And the way that at that time they were going to track it, there were not birth certificates or birth records at the time. And so what they did instead was they used quote unquote property records as the original birth records of people who were enslaved in New York City to enforce a law or to track and ensure emancipation at a certain age. But it really struck me that our original birth certificates were property records of human beings, even here in New York City. And so that's a part of our history that we have to acknowledge and reckon with, and that's part of what we're going to do in the conversation tonight. So welcome to the Birth of Identity, Race, Racism, and Personhood in New York City Health Records. Our panel this evening is going to explore the profound and often overlooked history of how birth records in New York City have shaped and been shaped by societal constructs of race and identity. From the legal importance of these documents to the lived experiences of families and the historical context of their creation, we will examine how our past continues to influence our present. I will be your moderator. Again, my name's Michelle. And before we begin the panel discussion, we wanted to have just some grounding historical slides from one of our experts at the health department. Muriel Silin, MPH, is a public health leader who has spent more than 3 decades transforming how New York City collects, manages, and uses vital and disease surveillance data. Muriel is the Senior Director of the Office of Quality Improvement at the New York City Department of Health and Mental Hygiene's Bureau of Vital Statistics. She has seen more than 10 commissioners in her time at the New York City Health Department. She also led a working group at the New York City Health Department to create a standard approach to the collection of race and ethnicity data, and her published work includes research on tuberculosis epidemiology, reporting timeliness, surveillance methods, and she also was the head of our disease surveillance work for some time. So with that, I'll ask Muriel to come on up.
Good evening. Can you all hear me?
Yes.
Excellent. I am so excited to be here. Thank you, Dr. Morse. Before we start, I want to mention that the topic we're going to be talking about tonight can be a little bit sensitive. You all chose to be here tonight for this topic. Thank you for attending. It's a really important conversation to have. But I want to mention this quick disclaimer. Speaking about slavery, enslavement, or race can be triggering or upsetting for some people. This brief historical overview that I'm doing touches on how the data changed over the years for race, later affecting race, identity, and personhood here in New York City. So when I mention slaves or enslavement or race, it's to reflect the data that was collected over the years, how it was analyzed, and later used for different purposes. That being said, let's jump in. So you might be wondering, why did we start collecting vital events records to begin with back in the day? So why do birth records matter?
On the block, he has seen 7 mayors, and he's been associated with Doris for more than 45 years. He was also the director of Municipal Archives from 1990 to 2005, after which he became assistant commissioner. And just to make sure we all know, Doris preserves and provides access to the historical and contemporary records of New York City government. The Records Management Division services 65 government agencies. Established in 1913, the Municipal Library maintains a collection of more than 400,000 publications and reports, and it's one of the largest archival repositories in North America, housing more than 250,000 cubic feet of world-class historical records dating back to the 1600s. So, thank you. So as always, we have a lot to talk about, a lot happening in the world right now, and never enough time. But I'm going to kick off with a bunch of questions that I'm going to pepper the panelists with, and then we will have some time, as was mentioned at the end, for Q&A by the audience. So get your questions ready. I'm going to start with you, Chanel. We heard quite a bit from Muriel, as well as kind of the purpose of this center, as well as kind of the political moment that we are in. We have also been very clear, both in New York City health data, as well as all of the work you're doing with Ancient Song. Many of our families in New York City, and especially here in Brooklyn, face systemic barriers to healthcare access. So could you talk a little bit about how you see those inequities as rooted in historical practices, and what patterns or policies continue to shape outcomes for our communities here in Brooklyn?
Greetings, everyone. How you doing? No. Greetings, everyone. How you doing? All right. That sounds a little bit better. So this is a really heavy topic, and I think that it's really imperative at this juncture that we're in right now. It's something that if you've been in the repro space, the birth justice space for a while, it's not a new conversation. We have continuously talked about the ways in which data can either be used as a tool to empower communities or systemically disenfranchise communities. Historically, birth data has been used in cases against forced sterilization of communities. Those are seen as being unwanted or unfit. We've seen it used in communities against granny midwives who have historically served, formerly enslaved populations of people. We have seen how it has affected indigenous populations and indigenous midwives and the ways in which they are able to traditionally practice the care within their communities and function on a daily basis. And we see it presently today, right? We have maternal mortality review committees, and I happen to have been on one here in New York City. And the data that was presented there came from PRAM's data, right? Information that was collected at the birth, right? It told a story about the birthing person. It told a story about who they were, how they cared for themselves somewhat, right? It told their race, it told their age, their time of birth. It also told about a fetal demise, right? And it was interesting being in a space with other professionals because it was it was doulas, it was physicians, it was midwives who were in the space. There were other public health professionals that were there. And although we didn't know the names of the people, when you looked at the information that was presented, it told you a full picture of who this kind of this person was, or who the perception of who you thought that they were. And it's very interesting how you can look at something and someone can perceive to know who you are based on the information that is presented. They can perceive to say that you are low income. They can perceive to say that you are uneducated. The perception could be that you didn't take care of yourself. The perception could be that you didn't take care of your child, right? And so we have seen, even in writings by Black historian Deidre Cooper Owens, Medical Bondage. And if you don't know that book, please go out and get it. And I sat on the stage with her a couple of years ago, and we talked about the ways in which she used health data and records within various different counties and states to be able to compile information around what was happening to folks, right? The fact that Black and brown bodies were used to advance medical science, but yet when it came to that information being presented, it was whitewashed, literally, right? How we see things like Henrietta Lacks, right, and the HeLa cells that are continuously used today. So the medication that you use probably came from the cells of this Black woman that were used against her will, right? And how that data has continued to shape the ways in which we live our lives today. And so, I mean, we're living in a very precarious time. I'll talk about it later, but I'm going to talk about birthright citizenship, which is something that is relevant today, right? And that is using birth data, right? That is using something, the 14th Amendment that was put in place to really secure the rights of formerly or enslaved Africans right here in the United States, because we were not seen as full human beings. We were seen as 3/5 of a human being, right? And so that means that you were treated as less than, you were treated as chattel. And so we are now in the space where our policy and how birth data can be used to either empower folks, or it can be used to take away that same power that they would have, those same freedoms that we would like to, that we all want to have and we want to exhibit every single day.
Thank you for that. It is incredibly sobering to hear you describe it in that way, and both kind of perhaps the gift and the curse, right? The opportunity for rights and the opportunity to take away rights.
And I think too, I think we sometimes as human beings, we will put stuff in little compartments in our mind and say that doesn't have anything to do with me, right? Because the birthright citizenship policy that is being presented right now is in respect to those who are undocumented, right? And you'll say, oh, well, I don't know, I'm not undocumented. Like, that has nothing to do with me. But the reason why the 14th Amendment was even created was to give you citizenship, because you didn't have citizenship because you were seen as property. So if you could easily say that someone who is undocumented, because they have a child here on U.S. soil now, which it's taken presidents, it's been presidents over and over and over again, that anybody, because of that 14th Amendment, if you were born here, you are a U.S. citizen, regardless of whether your parent is a citizen or not. Once we strip that away, then we are taking away the foundations and the purpose of what it was created for to begin with, which means that if it can happen to them, it can happen to you.
Mm-hmm. Absolutely. Yes. Thank you for that. Crystal clear. Crystal clear, as always. And perhaps that's a good transition to my next question, which is for Professor Mezey. We often think of birth certificates as kind of these routine documents. People are getting their real IDs. I don't know. I had to dig mine up recently and try to figure out where is my birth certificate. But they carry immense legal rights, as Chanel was just describing. Can you speak kind of from a law perspective about how birth certificates as routine documents, as vital statistics documents that we use all the time in the health department, how do they function as a gateway to rights like citizenship, Social Security, access to public services, and then what are the consequences when families face barriers in obtaining them or correcting them?
I am happy to address that. I want to say that I'm really grateful for what you said, Chanel. It's a great and important sort of thing to think. As I talk about sort of legal categories and consequences, it is attached to everyday lives and rights, and it's really important to sort of keep that in mind. I also think it's incredibly important to always think about the role of any classification system and collection of data as both as being a double-edged device. That is, creates the power of recognition and inclusion. It's a form of representation in a sense, but it is also always a potential form of surveillance, control, disenfranchisement, and disempowerment. So I thought what I would do is start with just something that I think is kind of interesting, which is and sort of compare birth certificates to things like census, which is a federal government classification and data system. But there is no federal birth registry like there are in many other countries, including the UK. The United States, as the federal government, didn't even collect birth data at the federal level until the early 20th century, a full 100 years after New York City was collecting this data. There are no standard birth certificate documents. There are, all 50 states collect racial data, and this is so that there's a national vital statistics system and health statistics center that does compile this data. There are many different forms. And as Muriel was saying at the beginning, right, this started in churches and private homes and midwives' documents. And then it became states and counties and sometimes cities that were really at the forefront of collecting birth data. And so the National Center for Health Statistics estimates there's something like 14,000 different birth certificate forms used in the United States. Really, I mean, just different, not only are different states' forms different, within each state, many different forms, obviously.
It shows just why our maternal health and reproductive health landscape is so fractured, because we don't have any centralized system.
Right, which is weird and problematic and maybe good. For precisely that reason of like the double-edged nature of this data. And the other interesting thing that I thought I would share is like it really wasn't until the 1940s that people routinely kept birth certificate documents, and it was during the war that employers began asking for birth certificates, I think as a sort of test of national loyalty during wartime. And roughly 1/3 of the working population requested birth certificates from their states during that time. And it was after World War II that birth certificates became routinely used for things like school, unemployment, and much of the sort of core documentation that we use it for. So let me get to what does it do? Why do we have it? I'd say the birth certificate in some way, and for this reason, it's interesting that it is so fragmentary and collected by the states. It is the most foundational document of one's legal existence in the country. It's one's visibility as a person in some sense. And in terms of nationality, and I would also like to talk about birthright citizenship at some point, maybe later in the conversation, it documents, when you're born in the United States, it documents your citizenship as a US citizen. It gives you a nationality. And having that, like, status, that citizenship status and the nationality, like fundamentally protects children from being stateless. So if they lack the ability to be claimed as citizens elsewhere, the fact that they are given US citizenship at the point of birth in the United States provides for national identity. It also protects them from being wrongly deported, from being separated from parents, and especially makes them less vulnerable to various forms of exploitation. Parentage, the birth certificate documents parentage, and that then is incredibly important for the parents themselves, especially if they're unmarried, but even if they aren't, legal parentage guarantees parental rights and responsibilities, medical decisions, custody, all kinds of financial support, insurance benefits, inheritance rights. So the parentage piece of it that's listed in the birth certificate is incredibly important. The US has a kind of template standard certificate of live birth that actually asks about some of these questions that lead to perceptions and judgments, like the education level of both of the parents, the race and ethnicity of both of the parents, the medical care that was received during pregnancy, many of those, any kinds of birth weight issues, like lots of things that together are really personal and intense information that is often collected by those states, even though it doesn't necessarily appear on the document that you receive from the state. Proof of age, also one of those things that has huge legal consequences for registering to vote, for enrollment in school, for marriage, for the draft, and protects from early marriage or child labor or forced military service. There's essential services that birth certificates are really important for: vaccinations, employment, government benefits, critical health care, and also important for freedom of movement. It's how you get your driver's license, your passport. And I would think lastly, the information that's collected, and this is really also specific to race data, that data is used across so many different federal agencies and is implicated in many, many different federal civil rights statutes, and it impacts the civil rights and the civil remedies that are available across the country. And that includes things like education grants, public health programs, community reinvestment programs, welfare and veterans benefits, and basic civil rights too. So that's all information that aggregated is really important. And I think, I'm not really speaking to this particular moment. I'm not sure you want me to right now. I just like, the thing that I worry most about right now is states providing data that can be individualized, as opposed to aggregated population-wide data. And I say that because we are living in a moment where the federal government is becoming so much more aggressive about targeting and disempowering people of color and trans and non-binary people and immigrants. And those categories in particular seem to me to make this data and those folks especially vulnerable if any of that information is provided in a way that can be individualized or you know, allowed, and not only just targeting. I mean, the proposal of denaturalizing, there's a proposal by the administration to denaturalize formerly naturalized citizens, to end birthright citizenship, and to literally deny the existence of trans and non-binary people. So all of those things are both the data that's collected with respect to them is literally vitally important for them and for us as communities together. But it really, that's the part that keeps me up at night, is to what extent is that then data that can be weaponized? Exactly.
Well, there's a lot to think about in that response. And I will also acknowledge that in the New York City Health Department, we happen to be an independent vital statistics jurisdiction, and we issue hundreds of thousands of birth and death certificates every year. And despite that, and in fact, as the acting commissioner, I get to sign the birth certificate. So, but I had not thoughts about a number of the things that you just described, including inheritance. I hadn't thought about that, and so many of the other pieces you mentioned. So I know we will get more into this, especially this issue of identifiable data being shared with the federal government in a routine way. So we'll dig into that more in a moment. I do want to turn to Muriel next, who really kind of gave us this kind of grounding background on how we got to where we are now in terms of the vital statistics that we collect at the health department and birth certificates at the health department here in New York City. But we are in Brooklyn, and we're at the Center for Brooklyn History. So early Brooklyn birth records give us a glimpse into the city's population in the 1820s. And you've spent some time digging into these records. And I'm curious if you could share with us some of the patterns or surprises that you've uncovered in the records and how they challenge or confirm, your understanding, our understanding of life, of New York City, of migration, et cetera, in that time period.
My time with the records was very fascinating. Fascinating for so many reasons, because all those nuggets of information about the city, what was going on, who was being affected, it was thoroughly enjoying. I enjoyed it so much. And I was surprised by so many aspects of the data that slaves were collected as property for so long, that, eventually into the 1820s, you saw a lot of migration happening still. The country is expanding. New York City is busting with economic opportunities. It's really a bustle and hustle for business. So many immigrant groups were migrating here and putting roots here and forming communities. So you have a lot of people going and coming into New York City. So when you look at the birth records, you'll see they're from Europe, they're from Ireland, Germany, England. Sometimes they would travel into Canada and find their way down to New York City. Different ports. New York City had Ellis Island as one of the main ports to come into the U.S., and then you would venture into other parts of the country, right? But sometimes you would come into Canada, and then they would make their way down. So just finding out all the different ways that people came into the country, and settled here, that was really surprising, But I didn't know until this research recently for this project that many records were kept by churches and parishes and Bibles, family Bibles, and so on. I found that very fascinating. You just assume that there was always some kind of civil official registration, but that wasn't always the case, right? We know things evolved. So, it was really very, very interesting finding all these nuggets of information. So now, in the 1820s, if you were here in the city and, being born, you may, as a white person, you will find your records quite easily, right? But if you're a person of African descent, your ancestors were slaves, that may not be as easy, right? Because you may need to do a lot more digging and researching. So those records are not going to be as readily available. They're going to be indexes here and there that may have information about your ancestors, birth certificate, death certificate. So it may take you a little bit more time to trace your roots, in other words. So all of that was fascinating to me. I know Dr. Morse mentioned the 1799 law for the gradual abolition of slavery. But it didn't happen overnight. It was truly gradual. It took a while, really from 1799 until 1827, when New York State abolished slavery officially. That was 28 years. That meant from July 4th, 1799, a person born of a slave was still in servitude to their mother's slave until they were 25, 28. So there might have been a period when the mother was still a slave, but then now the child became a free person.
And life expectancy in the 1820s was
not
very long.
Not very good. So if you lived to be in your 40s, 50s, that was a miracle right there, You made it. But I found all that information to be very, very fascinating. We know the 1817 Act relative to slaves and servants set the date, because the gradual thing that was happening, it wasn't going to happen often fast enough to truly free everyone. So if that law wasn't passed to say, okay, we need to set a date, 1827 is it. And that happened. So many communities of color, former slaves, celebrated that event that year. Because if it wasn't for that, slaves would still be in servitude for many, many years if that didn't happen. So today, African Americans who want to trace their families may find it harder to find records, but it is possible. If they take their time, find the right indexes. I found something called New York Northeast indexing for slavery. That's one source, for example. That's just an example of one index that can help African Americans trace their roots. So as far as migration, we know New York City was bustling and expanding a lot because of the growing economy, right? Birth records usually told us where their families, where their roots came from, right? From Europe most of the time. As New York City changed with these immigrants, we started to collect more information about them. So now as we're getting more Japanese and more Chinese and more Koreans and other groups settling, it wasn't just the U.S. Census collected this information. All of that was happening. All these demographic shifts were happening at the local level, and then federally, they decided, okay, we see a lot of Chinese, we see a lot of Koreans. We need to start collecting data on them as far as their race, because we need to reflect what's happening right now. Yeah.
Thank you for that. I think what you're also highlighting, Muriel, is kind of like we think of our society, of course, shifting and changing so much over the past several hundred years. But then how is that reflected in our policies, in our data? All of those kinds of things are not always easy to tease out, but very, very, very important and certainly complicated, right? And as you were alluding to, driven by capitalism and driven by, a booming economy in New York City in a way that is very unique, let's say, compared to other parts of the country. So thank you for that. I'm going to turn to Ken next. Ken, who spends a lot of time in thousands and thousands of records and tries to make sense of them. Could you tell us a little bit about the records that are maintained at Doris and how they've helped us to understand issues of agency and identity over time?
Sure. Thank you very much for inviting me to join this panel. I'm always happy to talk about our library and archives program. As Dr. Morse said, we're the largest repository of local government records in the U.S. And if I do say so myself, we're the best. Okay. Now you want to hear about types of records. Okay. We have records of decision makers. These are the records that answer the who, what, where, when, and why questions. And beginning from the Dutch colonial period in the 1600s through the mid-1800s, it was the legislative branch that made the decisions, and we have their records. Then, beginning in the mid-1800s, with establishment of functional departments, such as police and fire and health, all reporting
1805 for us, just to be clear.
Right. Yes. All reporting to and corresponding with the mayor, that's where you go for decision-making records. And we have records of the mayoral administrations from the mid-1800s right through the prior administration. Thousands of boxes and many terabytes of records. Then there are the records created by city workers doing their jobs, such as building the Brooklyn Bridge, 8,000 plans. Building Central Park, another 2,000 plans. Taking pictures of buildings for property tax assessment purposes, a couple million pictures in 2 different collections. Or helping needy New Yorkers, which the Department of Public Charities did in the almshouse, and we have their ledger records too. Then there are records that tell us about the people of the city, and that brings us to the Department of Health and the historical vital records now in the municipal archives. This is 16 million records, more or less, birth, death, and marriage. The oldest record being the register of deaths from yellow fever in 1795. Now, I hope you had a chance to look at the manumission record that we've been speaking of. To the left here. It's from the town of Gravesend in Brooklyn. Now, although these records document the births of enslaved children, they were not created for public health purposes. They were, as we've discussed, they came about in response to the 1799 law. But thinking about these manuscript records, I thought maybe the health department vital records could tell us more about these enslaved children, maybe from their later lives. Problem is, the vital records for the towns in Brooklyn and Queens where these manumission records were filed generally don't start until the 1880s. But let me give it a try anyway. So, I started reading the death ledgers. I was in the town of Newtown, Queens, and I came across this entry, number 982. Date of death, March 2nd, 1885. Name of deceased, George Rex. Age 89. Then under occupation, the clerk wrote in a very bold script, the last slave. Apparently, Mr. George Rex had been born and lived at least part of his life as an enslaved person and was well known enough in his community as the last person with that experience. Now, the important thing is that the listing gave his birthplace, which was Purdy's Farm, his residence, Jackson Avenue, but most important, it told us where he was buried. Now, we know that people are often buried together with family members. Now, I haven't done this, but my idea is that if we can find out the names of other family members from the cemetery, then using the vital records from the health department, we can make a family tree for George Rex. Maybe even find his descendants to this day, which I think would be fantastic. So thank you, Department of Health, Vital Records, for helping give identity and dignity to Mr. George Rex and others like that. Thank you.
Thank you for that. Yes, same. That really hits hard. I had a whole nother round of questions for the panelists, but I think we're only going to really get through that first round because we do want to have time for your questions. So maybe what I'll do in round, of course.
I just want to take a moment because I'm looking at other people in the crowd who are also emotional. What you just did was humanize someone.
Yes.
In the most beautiful and amazing way. Because one, by saying his name, he existed. By telling even that one line, you've told some part of his history and who he is. And so many of us who are of African and indigenous descent go through life trying to figure out where do you fit in a place that sees you but doesn't see you at the same time. You ever walk around and be the seen unseen? And his spirit now has the opportunity to have some semblance of peace. And That's why it's also important for us to collect data and information, because it tells a story of people. It tells a story of community. It tells a story of our humanity. And in the same way that it can be weaponized, it can be created and used as a tool for joy and for advocacy and for us to be able to center ourselves and see ourselves in a world that oftentimes does not want to see you. And that is essential to the human experience. And so as we are talking about data, and we're living in this space right now where data is being weaponized or it's being silenced, it is also imperative for you as individuals to collect your own data, much like our ancestors collected data. You mentioned churches. And one of the things in Black households that you will oftentimes see is a Bible. And the reason why you see a Bible with someone's birth and death day and who got married to whom and when that happened was because the only thing that you could possibly have oftentimes was a Bible. And you might find a lock of hair, you might find somebody's old belly button piece. Crazy. It's crazy work. But those are historical archives. Right? Those are ways for us to remember each other, to tell a story of who we are. W.E.B. Du Bois has a book called Data Portraits. And Data Portraits literally is a collection of, I call it the first census, where he collected data on people of African descent from 1887 to 1890. And it was used specifically to be able to advance policies around abolition and to show that we had full lives, that our children were being educated, that there were women who were giving birth, that, we were educators, and how many, teachers were in a particular space, and how we were not just we were taking up space, right? But to show how we were taking up space and how our communities were thriving in amazing and beautiful ways. And so as we are living in whatever this is, I don't know, this is a bad episode or something. And there are consistent attacks to dehumanize us and to desegregate us and to other us. We have to remember that we are not, no one can other you. No one can take away who you are. No one can take away your identity. No one can take away your lineage. No one can take away how you show up in the world. Be you, be bold, be all of the things that we need to be, because the data is there and it's there to tell a story, so that even if we don't live this lifetime to see it right now, our children and others will be able to see it.
Thank you for that, Chanel. And just thank you for asking us to pause at such an incredibly important moment in this conversation. It does feel like perhaps a good moment to pivot to the audience and see what questions, comments, reflections you all may have. We have a mic. And take the time you need to process and take a deep breath and reflect. But I can imagine you may have some questions for these incredible panelists. Yeah.
Is it turned on? I have a question for Ken Cobb. Can you tell us, are there any specific documents at the Muni Archives that are especially relevant to African Americans for figuring out their own family history or whatever?
Well, the manumission records that they created in response to the 1799 law, of which there's one there, that would be the starting place. We're actually have a transcription project that you can volunteer to do, to read these help us read these records and put them into a searchable database so that we can all then use them to build family histories. So I would say that would be the best thing to do. Go to our website. Whenever in doubt, go to the website.
For sharing everything you've spoken about this evening. I know you mentioned that there's a little bit of a double-edged sword in both directions about having these documents standardized and managed on a federal level as opposed to a state level. Do you see a situation where, I don't know, all the, like, New York, California, Pennsylvania, Maine, like, standardize their documents, so at least you can attempt to have some sort of consistency as we go forward, even if the states are going to continue, even as the states continue managing all these papers?
You go first.
So let me see if I got the question right. So whether positive or negative, do we see any way where state data is going to be standardized in such a way or be replicated in other spaces? Am I correct? Yeah, so that it would be easier to bring all the data together. Okay, so policy-wise, I will say that I've worked on federal policy to try to find a way to be able to standardize reproductive health data. That is good in some aspects, but in other aspects, it could be used as a tool to weaponize those who are trans, who are non-binary, who, you know, even like our health data systems that we have right now, right? So the city has a data collection tool where you can go to one hospital, and sometimes we don't read documents, and it's really important for us to read. Yes. Because sometimes you can give away your permission for your health records to be shared with another institution within the city. Now, while the idea around it is that if you go to any kind of healthcare facility, someone will be able to easily pull up your records, it's good in theory. And you know, the flip side of that is that it could also be weaponized, right? And so we have to find ways to really create safety nets for our most vulnerable populations, for all populations, right? Because all of our health data is personal, right? That's your own personal information. So we have to work on what does that look like for everyone. What has happened, though, is that there have been states that have shared information, right? So information that has been de-identified to find creative ways to lift up maternal health policy and other reproductive health policy. So that is, so like the use of maternal mortality review committees, or, you know, the CDC previously was going through PRAMS data, right? And PRAMS data is literally birth data, right? And it was being used to understand like what states needed more funding, like HRSA funding and funding for other specific programs in rural areas and things of that nature. Now that same information, CDC has been told they cannot collect PRAMS data, and the whole reproductive health department has been dismantled, right? And so all of the work that advocates have done to really create space where there was no space, where this data wasn't originally collected at the volume that it was being collected at, is going to the wayside. Also, a lot of epidemiologists who happen to be Black women have lost their jobs. And so what I propose to folks is like, we really have to look at epidemiologists as a source of knowledge and information. And if you know one, try to say like, how can we create our own archive of information that can be used collectively to continue to further the issue areas that we have within our respective neighborhoods and areas, and then share that with others in meaningful ways that we know are going to uplift our communities.
I think I would just add one little thing, which is to say there is a whole lot of consolidated data at the federal level that you can use to see what's happening in different states. And there is a sort of federal collection of that data. That data is, though, capable of being used against the very people who have contributed that data. And I think that's where the question about how to deal with that is a hard one. And I think it becomes increasingly important to think about the importance of confidentiality on state data forms and what that confidentiality goes to. And sometimes, like, for example, birth certificates ask for the nationality of the parents. If that is not highly confidential, and if in fact, so Trump's executive order does not end birthright citizenship, but it cuts back on birthright citizenship for those children born in the United States to non-citizen parents who are either here without legal status or here with legal status but temporarily here. Those are precisely the people who may not accurately fill out a form or even provide that information at the same time that they want their child desperately to have a birth certificate and have nationality. They don't want to endanger themselves by listing their nationality or lack of U.S. citizenship on the form. And I think thinking about how the importance of the data for telling human stories and allowing people to be visible is being jammed up against the incredible desire of the current federal government to use that data in ways that punish people.
My first question is for anyone on the panel. What is the oldest person that you've come in contact with in person that still have their birth certificate, whether it was laminated but they still had it in their person that you've come in contact with that you didn't look up?
So I actually have my family tree from the early 1800s. And so my family is from the New York area. They are a combination of the Dutch settlers that were here, the indigenous people, the Lenape tribe, and freed African or formerly enslaved persons. And I have a birth certificate that is from the early 1800s, but I have the last name is de Vries de Groot. It is also yes, and I've been able to trace it on my grandmother's side all the way to the present, which is something that most people, a lot of us, can't do. So yeah, I'm really proud about that.
My next question is for Ken. I'm sorry, I didn't catch the last name of George that you said his last.
It's de Vries. Oh,
George. I'm sorry, Ken. I didn't catch the last name of Rex.
Yeah.
What? Rex. Oh, Rex. R-E-X?
X.
Oh, okay, thank you. And I have one more question. Did they start the difference between the short form and long form birth certificate?
That's a good question. I don't have that answer for you. I know we switched to collecting race data to the confidential medical record. That's not given just to everybody. So, you need to be eligible for that. But I'm not sure when that switch happened. I'm not sure when the long form came to be. I know that's the one that's.
Are you talking about the census? That's just the only point. For the census or for?
No, for the certificate.
Yeah, we have
For the
birth
birth certificate, there's usually the short form, which is the basic facts of the birth.
Yeah.
And then there's the long form that has all the medical information, the race data, ancestry, and all that. So I think if I remember correctly, when I went back to look at all the annual vital statistics summaries, I noticed some in the 70s, 80s, but I can't give you an exact date when that happened. Maybe Gretchen in the audience might know that, my boss in the audience.
So there's the short form certificate and the long form. So before, when people were just writing everything, there was just one piece of paper they would write it on, right?
Right.
But when computers would come along, or the mainframe computer system, which was around, Muriel was saying, in the 70s, there was a choice of to print a smaller amount of information on the piece of paper when it was issued versus the longer. And so the smaller amount, that's called the short form. The longer amount is sort of like what you see when on the original, it has all of the information on it. So I'd say it's probably consistent with the advent of use of computers, and that was probably around the 70s when we started using a mainframe computer system.
So, yeah. So my recollection is correct.
We have time for 2 more quick questions, one over here and one over here.
Oh, hello, my name's Kathleen McLean with the McLean Collective, and Muriel's my best friend from college. So proud of her. She's going to kill me later, but I had to say it. I was just wondering, how do societal perceptions of birth identity impact individuals' mental health and well-being? What do you think?
Give me the question one more time. My perimenopause brain slowed down.
Oh, no, it's fine. How do societal perceptions of birth identity impact individuals' mental health and well-being?
Okay. I'll speak from a personal perspective. I'm a mother of 6 children. Yet some people probably here were like, "Whoa, that's a lot." I have a 17-year-old son. I have soon-to-be 16-year-old identical twin daughters. I have a 14-year-old daughter. I have a 9-year-old daughter and soon-to-be 8-year-old son. And the societal perception of how I am viewed in my motherhood affects my mental health every single day. Especially being a Black woman and a Black mother. One, Black motherhood is always criticized, it is shunned, it is othered, it is oftentimes seen as less than. I've had the weirdest questions from, like, do they all have the same father? Yeah. The society is very interesting. How do you take care of them? And you live in New York City. And so that weighs on a person. I have seen folks who have come from different identities, different backgrounds, same-sex couples who are concerned about how they're going to be perceived in their parenting. I have seen individuals where English wasn't their first language, and because it wasn't their first language and they had another child who was translating for them, how that affect their identity and how they were perceived in their parenthood and their personhood. And so I would say it has a huge impact. And when I'm working with mothers and individuals, pregnant persons, I always say, like, you define what your own motherhood has to look like. I can't control another individual's perception of what you think something is, but a lot of it is based on false narratives that have been put in the ethers to make us other one another consistently. When at the end of the day, what I've realized is that in working with pregnant and parenting individuals, their one overall goal is to parent. They want to parent. They want to love their children. They want to make sure that their children have the best things possible. It's even like when we see genocide happening on a consistent basis. And as a parent who watches children be consistently put in positions where they have to now become adults or think like an adult, or when I see mothers have to sacrifice themselves for their children, because as a parent, you're going to throw your body in front of your child to ensure their safety on a consistent basis, no matter what, no questions asked. And so to your question, yes, but also, yes, there is hope. And how we have hope is by us not, when that thing comes in our mind, when we automatically like start to be like, you see that one over there? Stop yourself, right? And when you see a mother struggling, or you see a parent like trying to go up the subway steps, or you see somebody, say like, do you need help? Even if they say no, or just say like, you okay? Even if they're like, I don't know if I'm okay. That's okay too. But people need people to check in on one another, and we have to be consistent about it. So I hope I answered your question.
You mentioned a couple of important incidents over the history of New York City, whether it's the slavery law or the combination of the city coming together. We just went through COVID, a big happening. I don't quote out of it, but there were a lot of city programs, obviously medical records around that. what do you guys know of that data, the records? Where does that stand? And also, is there potential really negative outcomes of that? Or is there maybe something positive from that data we can take as well?
Well, that's a big one. I think I'm gonna, yes, that's certainly, that's a me and Muriel question, I think. I would love, Muriel, if you want to start, and I can kind of come to the other side.
First of all, we need that data. We need it to dissect it by communities, by the races, by the ancestry. We know there were disparities. We knew when we saw the beginning, when we saw what was happening, we saw some folks were not being as affected as others. It was clear cut. We needed that data. That being said, we have the infrastructure in our agency to protect the data. I feel confident that we are going to do the right things and share it the right way and analyze it the right way so that we can do what we need to do as public health professionals and put in place all the interventions that are needed to address what needs to be addressed. So that's the basic foundation of what we do. If we collect the data, we're going to find a way to protect it on our end and share it with only those that need to have it, and we'll use it for the right purposes. We'll do our best, right, to make sure that happens.
Absolutely, and I think for those of us who are kind of practicing on the, taking care of people during the pandemic, exactly as Muriel said, it was very, very clear how inequitable the impacts of the pandemic were going to be in that emergency phase. And I think, the New York City Health Department was doing a lot to really make those inequities in the impacts clear. And I think the challenge is often if we just show, well, Black people and Hispanic people in New York City and these neighborhoods were disproportionately impacted, without then also saying, because of our history, disinvestment, structural racism, sexism, all of these different, xenophobia, if we don't couch it in that structural diagnosis, then that data becomes a right-wing talking point for inferiority. And that's the last thing we want to do, is feed into that narrative of inferiority, right? But if we leave it open, like, oh, here's the data with no context, people come to their own conclusions about why that pattern is happening. So I think it's very important that when we present that data, we also acknowledge that historic structural context that created that unfair, unjust, avoidable outcome. And then I will also say, maybe you were a plant. I don't know if you work for the health department, but we have a goal for New York City that we get back to, actually that we achieve our longest life expectancy ever. And our goal is 83 years by 2030. In the height of the emergency phase of the pandemic, life expectancy dropped for everybody, but it dropped more for Hispanic people and for Black people. And then ever since we started measuring life expectancy for Black New Yorkers has been the lowest of all racial and ethnic groups. And so even though our data from 2023, for example, showed that we're almost back to the average life expectancy that we had before the pandemic, what is also still true is that Black New Yorkers have, on average, 5 years lower life expectancy than every other group, and that has not changed. So we have work to do. And I think, the positive part of the story from the pandemic is that we have regained a lot of the life expectancy we lost. The reality is it is still profoundly inequitable by race, by geography, and by many other variables. So we have work to do, which is perhaps not surprising. maybe are we okay on time? Can I do a final?
Yes.
Okay. All right. So then what I'd like to do to close us out is to just ask each panelist to share a brief reflection on what your birthday wish is for the New York City Health Department as it relates to birth, identity, anti-racism, and vital records. The 30-second version.
I hope we come out of this nightmare administration, federal administration, mostly well, mostly unscathed. That's my wish, for us to get over that hump and get back to normality in public health and respecting data and using data to do public health as it was meant to be.
My birthday wish is to see us all organize our own data, our own forms of communication. We know that historically communities of color have had a long-standing mistrust around the health department, health in general, health information, rightly so. Right? And so how do we use our power as neighbors, as those who may be connected to community-based organizations or run organizations, to partner collectively with the Department of Health and other institutions to create our own, and I've spoken to Dr. Morse about this, our own blue check mark of trusted information, because in a world where we're getting so much disinformation, so much false information and fake news, we really need to have trusted sources. And so relying, I think, back to the realities of ancient times where, we use flyers. Ancients of days. And and you had to literally hand somebody something. And you had to talk to them. I think that's really important right now, as opposed to us being so reliant on this, because this is being used as a tool of distraction and of separation. And so we have to, the crux of it is for us to be together. And so that's my birthday wish.
Beautiful. I think my birthday wish is for you all, because it makes me wish that I were part of New York City.
Come join us.
I know, I'm living in occupied territory right now. I wish for you to take care of each other, all of you to take care of each other in ways that actually empower the least empowered among you. And if that can happen anywhere, it can happen in New York. And I also have a wish that collectively you all begin working on the George Rex project. And I think there is a really amazing collaborative project to be done there, where a lot of people would be totally invested in helping with that, myself included. You don't have to be from New York, but volunteering time to tell George's story, which seems really important and which seems like an important way to put data and human people back together again, so that you know what you're collecting the data for. And then I just want to say, if you haven't read Jennifer Nash's Birthing Black Mothers, just thinking about what you were talking about before, it's a really good, amazing, scholarly, but accessible book.
Okay. I wish you another 220 years of leadership in public health. Thank you.
Thank you.